be used in the cast dental restorations. So in the combinations of the gold with the other base materials, that will be the increase the strength of the gold materials. So there are two types of materials we have. One is we call the base materials, and another one is noble materials. Noble materials means, or noble metals means, like the gold, platinum, and palladium. Remember these examples: gold, platinum, and palladium. So these are the three materials: gold, platinum, and palladium, or gold, palladium, and platinum, because they are the expensive materials. They are known as noble materials. Other than gold, platinum, and palladium, any other metals, they are known as base materials. They are known as base metals. So base metals example is, say as for example, stainless steel, chromium, nickel, cobalt. These are all the base materials or base metals. So gold, platinum, and palladium are the noble metals. And other than this, any other metal, they will consider as a base metal. It can be MCQ question like, which of the following metals are considered as a noble metals? So in that case, you have to look for gold, platinum, and palladium. If we ask you guys what are the base metals, so you have to look for other than these. It can be stainless steel, it can be chromium, it can be nickel, it can be nickel chromium as well as. So alloy means the mixture of the metals. Alloy means mixture of the metals. So when it comes to the mixture of the metals, they will be mixed with the gold with the different formulations, and they will make the soft, medium, hard, and extra hard materials, which is very commonly we use in our dental practice as alloys. So first of all, what is alloy? Alloy means mixture of the metals, which also we discussed in our at the very beginning, like silver amalgam alloy, like silver amalgam, silver, tin, copper, zinc. When they mix together, they will make the amalgam, right? That is also a combination of the metals. So when the metals are mixed together, we will look for the which metal is most, and that will name of these materials. So the in dentistry we are using like the soft type 1, type 2, type 3, and type 4. This is about the different types of alloy. We call them the gold noble metal alloys. But here they are type 1, 2, 3, and 4. They actually depend on the amount of the gold. So as long as the type 1 alloy, it will have an 83% of the noble metals. That means the noble metals, it can be gold, it can be palladium, it can be platinum. They will be around 83%. That is the maximum amount. Then in case of the type 2, which is, and that's why it becomes soft. In case of the type 2, it will be have a 78% of noble metals, and all other remaining portion is the base metals. And in case of the type 3, it is about only 1% difference, that is 77%. And that one will be the hard one, and the extra hard one will be 75%. So it means that 75% of anything like gold, platinum, and palladium, along with the 25% of the base metals, that will be one of the extra hard metals can be used in dentistry for the indirect restorative procedures. Other than this metal, we also use the ceramics, because metal, they will not match the color, because gold will come golden color, silver color, golden color. So that means the metal will not very close to the tooth color match. But they will be used with in the stress bearing area because they are stronger than that of the ceramic materials too. But the ceramic materials, they will combination of both. They will give the strength and they will also match the color. As you can see, this is the porcelain cap. or porcelain brise. So brise is the combination of the multiple caps together. So ceramic are the compounds. It is a combination of both the metallic and the non-metallic elements. So metallic and the non-metallic elements combined it together, we can get in the ceramic materials. And the ceramic materials is used in dentistry for a longer period of time. And it comes with the different combinations. It can become with a porcelain fused to metal, or maybe porcelain bonded to metal. Sometimes porcelain fused to metal. It means that the base is the metal, on the top is porcelain. So it's called the porcelain fused to metal, or PFM. In short, we call them the PFM, which is very commonly used in dentistry. And these are the examples of PFM. P for porcelain, F for fuse, M for metal. Porcelain fused metal crown. You will see in the practice pretty much every single day we are having this type of restorations. We are giving the supply to our patient because it matches the color and because it also have the more strength in combination of both metal and as well as the non-metallic structures. As you can see here, the porcelain, it is the most commonly used in dentistry. There are new ceramics available nowadays that is called the zirconia. Zirconia is the latest type of the ceramics which we use in dentistry, but the porcelain is very old and is very common and is very cheaper than the zirconia. This type of ceramic is most commonly used in dentistry. The reason is, as you can see, it looks like a original tooth. So it combines the strength, translucency, and the ability to match. So what we want? We want the for artificial restorations should be strong enough, it should be translucent enough, and it should be match our natural tooth color. So all these three combinations can be seen on the porcelain. That means the strength, translucency, and the matching capability. So all this ability is present from the porcelain. That's why it is very commonly used in dentistry as a indirect restorative materials. It is stronger than any kind of direct restorations. Direct restoration means, example is amalgam, all kind of dental filling. You can remember like that. All kind of dental filling is considered as the direct restorations. And the fillings, they can be temporary, they can be permanent. So temporary is the one which is known as zinc oxide eugenol or the IRM, and the permanent are the amalgam composite glass ionomer. They are the permanent restorations. Okay, ceramic porcelain is used to fuse to a metal baking shell. Then it is fired and glazed, produced a highly smooth surface that is extremely hard and similar to the enamel. So that's the reason the porcelain is very commonly used in dentistry, because on a metal base, like as you can see here on the bottom there, the metal base. So this metal base, and on the top we can put the porcelain. So they will have the thermal coefficients is very similar. So when we apply this one on the top of the metal with a high temperature, metal should not be melt. So this is the way they are bind together. That's why thermal coefficients is very important. So that's the reason the metals are the base for the ceramic materials. And that's the reason here. As per example, the shading of the color matches tooth color well. That means the matching is very well with the porcelain, with the tooth color. It improves the aesthetics because as it match the tooth color, so aesthetic appearance is improved. And anterior teeth, we are using this type of prosthesis. It has a strength of the metal and good insulators. That means it will prevent any kind of hot and cold stimulations, and that's why it's called the insulations. And it also has the coefficient of thermal expansions. It will be expand or react similarly to the tooth structures, the way it has to be react the tooth and structure, not natural tooth structures with hot and cold. That's why the low coefficient of thermal expansions. So this is the reason the porcelain is very commonly used in dentistry. And that is one of the very common type of indirect restorative materials. And I think this is pretty much all about this chapter. Okay, any questions? Please go ahead. Okay. So in this chapter, you basically try to memorize the name of the materials. This is number one. Which materials used for what type of restorations? Direct restorations, indirect restorations. Direct restorations examples are, the amalgam, composite, glass ionomer, IRM, and whitening products. But even though whitening product is not a restorative material, it is the aesthetic materials. And indirect restorations, we talk about the gold alloys, base metal alloys, porcelain, which is ceramic, and the zirconia. So these are the direct and indirect restorative materials. And also try to memorize about their use, about their chemical ingredients, and where we use it for direct and indirect, and what is the comparison, which we discussed yesterday, the comparisons between the amalgam restorations and the composite restorations, and how they bond, the three bonding procedures. So that is pretty much about this chapter. Okay, so that is the one which is the giving a vast idea about the dental materials. Now we'll talk about um, a materials called the um,